So, knowledge mobilization. The key thing to remember about knowledge mobilization or KMB is that these reflect a set of actions we take or tactics we employ to bring about a desired change based on evidence or based on knowledge. Depending on the audience, we may use different strategies, including co creation or integrated knowledge translation, IKT, which engages those individuals who will benefit from and use the evidence generated from the very beginning of the research process. KMB refers to these strategies and processes that we engage in to help facilitate the change, which is actually quite different than the change itself. So, with that brief introduction, I'm now very pleased to hand the microphone over to my colleague, Dr. Tamil Kendall, Power's director, to share an update on Power's activities from 2022 to 2025. Over to you, Tamil.
Thanks very much, Lori. It's a real pleasure to be here with all of you from coast to coast today. So good morning and good afternoon. And I get the privilege of presenting some of our work over the last 3 years with a focus on knowledge mobilization. So as many of you will know, Power is celebrating 3 years building a national network of women's health researchers and raising the profile of research that is improving the health of women, trans, and non-binary people. Together, our 4 partners, the Women's Health Research Institute in BC, the Women and Children's Health Research Institute in Alberta, the Research and Innovation Institute at Women's College Hospital in Ontario, and IWK Health, bring together more than 900 women's health researchers from all different disciplines and across all of CIHR's health research pillars. And these individuals mentor more than 1,400 trainees each year. So it's quite an impressive network of women's health researchers. And as you can appreciate from this overview of our vision, mission, and the strategic aims that have guided us over the past 3 years, both contributing to the vitality and visibility of the women's health research ecosystem in Canada and supporting the translation of research evidence into action or knowledge mobilization is a central concern for Power and the Power partners. We're very proud that from 2022 to 2025, we've provided a platform to share the truly outstanding women's health research that is being done in Canada and by Canadian researchers globally by holding 23 women's health research events. And this has reached more than 2,000 participants and folks from all across our country, but indeed from around the world. With its 4 partners, Power has developed a coordinated approach to communications, which leverages both Power-specific and partner communications channels to share women's health research events and content across our institutions and with the broader Power community. We also engage in targeted communications towards knowledge users. So in the first example that I'm sharing here, our target population or target audience are women, trans, and non-binary people. And this campaign, which was done in collaboration with Science at First, highlighted the issues of women's health information in the context of a national campaign that was bringing attention to how misinformation is negatively affecting health. So what we had here is researchers from across the network both identifying and busting their most hated women's health myths and misinformation. We also engage in targeted communication to research decision makers. So for example, and this is more through letters and information briefings, expert testimony, we've advocated to the Canadian Institutes of Health Research Science Council about the need to increase the availability of sex and gender disaggregated data in the context of publicly funded health research, as well as for more investment in women's, trans, and non-binary health research. And in the case of the Parliamentary Standing Committee on Science and Research, we offered both a brief and gave expert testimony on the strong evidence that supports the value of diverse sex, gender, and ethnicity in research samples for rigorous research, as well as the value of diversity for productive problem-solving science and the need for more investment in women's health research. So with the exception of our leaders in this space at the policy level, the Institute of Gender and Health at CIHR, now including women's health research as a specific pillar within their research priority plan, which is a welcome development. And the generational National Women's Health Research Initiative that's being funded through IGH, we haven't yet seen the change that we want to see in terms of more accountability for sex and gender disaggregated data, and commitments towards sex and gender and health research, nor greater investments in women's health research. We still only receive approximately 7% of the federal funds that are allocated by CIHR. However, Power continues to engage with the women's health community and the women's health research community in an effort to bring about these important changes in our broader ecosystem. I also want to speak to the platform. So really, Power's research seminar series has focused on engaged research, or how researchers in the women's, trans, and non-binary health space are doing integrated knowledge translation work. So we've really focused both on the how of how they're doing this, as well as the results that they're achieving by doing so. And we've co-created knowledge with these researchers and with other communities. So here are two examples of this. A knowledge summary and tool on partnered women's health research, which was created by harvesting the learning of the 2022-2023 Women's Health Research Seminar Series. That showed how women's health researchers were effectively working with communities, healthcare providers, and policymakers to design and implement research, and how these partner ways of working, supported by different tactics for engagement, were resulting in long-term sustained partnerships that were driving improvements in healthcare delivery and policy. The Beyond the Binary in Canada project, I'm going to delve into in a bit more depth. And it's an example of how Power is acting as a vehicle for scale and spread, moving from the local or provincial level to the national level. And I also want to emphasize how this process is allowing us to develop and strengthen networks of champions for moving knowledge into research practice. So the Beyond the Binary certainly has not been a straight line. It started in 2019 when the WHRI identified a real gap in resources for gender inclusive language practice specific to a research setting. So there was starting to be more guidance for healthcare delivery, but there was very little about gender inclusion in research. And so this led to a Michael Smith Health Research BC convening and collaborating grant that created the context for partnerships, training, and to co-create the first version of the Beyond the Binary in BC guide. Power then got involved, and we applied for a CIHR grant to expand nationally, allowing us to make sure that the content was nationally relevant, to bring in new practice examples and case studies, for example, from rural and remote communities, and of course, to translate the guide into French to make it available in both languages. And now in 2025, we're engaging with research ethics boards, reviewers, chairs, and administrators from across Canada to develop tools that will support them to incorporate review and recommendations on gender inclusive language and gender equitable research. This is with the goal of realizing the Tri-Council policy statement on research ethics, which puts emphasis on justice, That is, that no one should bear a disproportionate burden of research or be excluded from the benefits of research, including because of their gender identity. We've really worked in an integrated knowledge translation model in terms of the structure from the outset, involving both researchers as knowledge users and people with lived experience as knowledge users. Um, and this structure has allowed representatives from the research community and people with lived experience of gender inequities to dialogue independently, to promote safety and have a very free exchange, as well as to come together in facilitated dialogue. What I try to visualize for you in the next 3 slides, using the logos of the participating organizations as how the project has gone through its different iterations, the network creating and supporting the movement of the information into practice has increased in size and density. So we see here in Beyond the Binary in British Columbia that we already have quite a multi-sector, both healthcare institutions, research institutions, non-governmental organizations working together. We then scale across the country with the additional partners in power, as well as additional academic and community organizations. And now our project has expanded to include 2 additional national networks, the Accelerating Clinical Trials Network and the Canadian Association of Research Ethics Boards, as well as Power. And we're just at the beginning of this journey. So this is an example, and I offer this to you. We are very interested in Power about things that are ready at the local level to be scaled up nationally. So if you have something that is verging on that and you want to share it, please reach out to me. I'd be very interested to learn about it and to see how we might collaborate and support that expansion so that we're making fantastic tools available and supporting the mission of excellence in women, trans, and non-binary health. So in summary, as far as knowledge users go, to date, Power's efforts have been being towards building and strengthening a national network, and we've engaged as knowledge users or target audiences, the research community, to share women's health research, but also to educate about strategies for integrated knowledge translation and knowledge mobilization, and to co-create guidance and tools. We've also looked to federal bodies who are making decisions about research funding and research policy to advocate for the importance of women's health research and disaggregation of sex, gender, and ethnicity for the relevance of health research. And then to women, trans, and non-binary people as experts about how to do better, more gender-inclusive women's health research, but also to combat misinformation and to provide the best, most up-to-date research evidence that is transforming care. So to make that information more available. And I have the pleasure of providing a more fulsome introduction for Dr. David Phipps. He is, as Lori mentioned, the administrative lead for all research and innovation programs and their impacts on local and global communities at York University. And he's received honors both from York and a multiplicity of other research and research mobilization organizations nationally and internationally for his work in knowledge mobilization, including the Queen Elizabeth II Diamond Jubilee Medal for his work in knowledge mobilization and research impact. And he was named the most influential knowledge mobilizer in Canada. He sits on knowledge mobilization committees around the world and, as we mentioned, is the network director for Research Impact Canada. So it's really an honor and a privilege to have you here with us, David.
Great. Thank you so much for that very generous introduction. And I look forward to seeing where this group goes, not only just in these 90 minutes, but over time. I'm going to share my slides. I've got some slides, got a little bit of interactive stuff we might do depending on the time. And I'm going to stick around and see how everyone is feeling right at the end after your breakout groups. So I'm just going to confirm that you can, let me just get this, that you can see the slides. Excellent. As mentioned, my name is David. My pronouns are he and him. And I was born to white parents in England, and we moved to these lands that some people call Canada when I was 2 years old. I live with my husband in Toronto, and that's on the traditional territories of the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the current treaty holders are the Mississaugas of the Credit. As mentioned, I am the Assistant Vice President for Research Strategy and Impact at York University, which means I have all of the research programs under my portfolio. I'm the guy that signs all the grant applications, and please get them into us or your research office in lots of time, but also all the innovation programs as well at the university. And Network Director of Research Impact Canada, which is a network of 41 research organizations building institutional capacity for knowledge mobilization. I'm just going to give it a little bit of grounding of where we are. So did you know that the Universal Declaration of Human Rights says in Article 27 that everyone has the right freely to participate in the cultural life of the community, to enjoy the arts and share in scientific advancement and its benefits. Scientific writ large to be the STEM disciplines, but also the social sciences, the humanities, and we've got the arts listed here. The work that we do to share our scientific advancement to create benefits for society, this is a fundamental human right. And just to locate what the types of impacts that we're talking about, generally, and this is a model from my colleague Julie Bailey at London Northeastern University, that research generally happens in academia. We know there's lots of excellent community-based research and research happening in policy settings and also research happening in industry. But generally, the work we're talking about happens where the research happens in academia, and the effects that we're looking for are felt of outside of academia. We're not talking about impact on scholarship. Your papers, your citations, your awards, your grants, those are really important, and we want you to keep doing those. But the effects that we're looking for are in society, on the environment, on health, on the economy, and culture. And Julie's definition for impact is the provable effects, we hope they're beneficial, of research where in the real world, and it's in quotes, it's not that universities are not in the real world, we are, but it's those benefits beyond scholarship. And just as an example of this, I've taken her model and I've added a line, an arrow on the bottom. So at York University, we host the Canadian Observatory on Homelessness, led by Stephen Gates in the Faculty of Education. And he's had a network of centers of excellence. He's had a couple of Shirk partnership grants. And so he does his research, but then he disseminates that through the Homeless Hub, which is an online repository of academic and gray literature around research for youth homeless, focused on prevention of youth homelessness. So he gets the research out of the university, but he also is partnered with Away Home Canada, and that is a national nonprofit that is implementing housing first solutions for youth across the country. And so he not only disseminates to community and to society, but he listens to the needs in society through his partnership with Away Home Canada. And you can see on the top right, the impact, and this is now over 2,500 youth have 2,500 youth have participated in some of his programs, and you can see the benefits to youth about returning to school, becoming employed, improve family connections, for example. So it's just to locate the knowledge mobilization helps maximize those societal impacts of research. Research Impact Canada, 41 institutions. I'm not going to stay on this too long. You can do it very quickly for your institution on the right-hand side. And we're from St. John's to Victoria, and we've got both U15 and undergraduate and comprehensive universities. We've got 4 research hospitals in our network as well. And so we are working together as a community of practice to build institutional capacity for knowledge mobilization, and we were founded by York and UVic in 2006. So what do we do? And I'm describing our network here because the invitation I had was to talk to Power about networked knowledge mobilization. So what do we do as a network of institutions? We build institutional support, and that means the people who are active in Research Impact Canada are people like myself, professional staff at the university. We don't have faculty appointments. We're not the researchers who are making the impact, but we're the institutional staff who are working with our researchers, our students, and their research partners to build knowledge mobilization and impact into their research programs. We help researchers and partners to demonstrate the impact of their research. So what was interesting, what Tamil said is that knowledge mobilization is how we do things, but impact is what occurs. And so I read recently that if impact is the destination, then knowledge mobilization is the journey. And so we want to be able to demonstrate that destination, demonstrate the impact of their research. And we've got some tools and some capacity building specifically on that. And then overall, we are a community of practice. We're knowledge mobilization and impact practitioners. Some of us are in the research office, like myself. Some are in community engagement offices. Some folks are communicators. We've got some librarians in the group. So we're quite a diverse group. And that's the strength of the network, is that we don't all look alike, that we've got different types of people with different types of jobs, really building the richness of the network. One thing that we do is, again, with another network, is we are a knowledge mobilization network that is supporting the knowledge mobilization of the Future Skills Center. And so this is a national organization. It's hosted at Toronto Metropolitan University, and they've got over 2,000 skills practitioners and skills and development practitioners, policymakers, employers, and subject matter experts. And they've asked Research Impact Canada to help do knowledge mobilization for the Future Skills Center and the projects that they're supporting. And what we do with their community of practice, so we're a community of practice that has supported another community of practice. And they invited us in because they recognize they're funding all of this amazing work for skills practitioners in nonprofits, in municipalities, in industry, and in provinces, but they weren't sharing that across. So they asked Rick to come in because we've got experience in brokering of community partnerships. We've got internationally recognized expertise, and we're innovative. We are trying to be ahead of the curve in this space. So that's why the FSC, the Future Skills Center, invited one network in to help out another network. And what we do with the Future Skills Center is we connect people to people, we connect people to knowledge, and we connect people to learning. And we do this through active facilitation. A community of practice is more than a website. It's more than a database. It's more than LinkedIn. Those are all really important. But we actively facilitate the engagement of the FSC partners and practitioners to connect to people, connect to knowledge, and connect to learning. This is just a bunch of the stuff we've done from April 22 to February 2025. We're still doing it. We've just been extended our collaboration into June of 2026. But we did a bunch of stuff. We threw basically a bunch of spaghetti against the wall and decided what would stick. We called that the learning phase. And now we're in the maturity phase where we've really pared down to peer learning groups, insight bites, and webinars, the sort of top three that you can see in each of the people, knowledge, and learning. And we're just in delivering on all of these for the Future Skills Center. We've engaged with over 1,500 members. They love what we do. Feel free, Power, to PDF my slides and share these with the participants so they can read about these on their own time. But then in June, Nicole wrote to me, and see, she was just saying before we came on that Nicole apparently, and you can correct me, Nicole, but I think you saw me first speak in 2014 and then saw me speak again you said about 8 years ago. And apparently that stuck. And she wrote to me and she said, we discuss how the role of networks you discuss in your paper could lay an important foundation and catalyze the conversation about how Power's role as a network can advance women's health research and impact in Canada. So I said, that's pretty cool. Sure, I'm happy to attend. And here we are today looking at that. And we did write a paper. We did some self-reflection with an assistant professor in the Faculty of Education at the University of Calgary, Steve McGregor, who worked with some network leaders within Research Impact Canada, and we studied the network and what we have learned from becoming a learning network. And that's really important, is we're a network that is learning. And so so Nicole and Power asked me to talk about our paper. So what have we learned by doing what we do? And it is about being a learning network. some reflections from me on Research Impact Canada is that we are a community practice, I said, questioning who are the experts. One thing we try and do within for our researchers who are experts in their field, but recognize that there is expertise of lived and living experience. There is expertise in community, in policy shops. And so we're really trying to balance the community, the non-academic voice with the academics experts. We don't want to take the expertise away from academics, but recognizing there are different types of expertise. We've got a boatload of resources. Happy to talk about some of those if that's of interest. When I said for Future Skills Center, we do active facilitation, that's the convening. We bring people together like this webinar today is actively convening. And the leadership, the shared leadership, we have members across the country who take leadership roles into of different working groups of and of our governance committees. And so it really is about shared leadership. And one thing we're really very conscious of is helping all, like high tides rise all ships, or there's an analogy there. We're really trying to bring up all institutions' capacity. Capacity building is what we do. We really want to build our capacity as knowledge mobilization practitioners so that we then can help all of our researchers back at our universities. And I mentioned also that we're professional staff, but by building our capacity as institutional employees, we can then help our faculty, our students, and their research partners. So that's a bit of the context that this paper was examining. It was published in this year in 2025, and it's called Network Learning for Knowledge Mobilization, Universities and the Pursuit of Research Impact, with Steve McGregor and myself as the authors. And we can put this link in the chat when we get back into the room. What we did was, what Steve did was he interviewed 20 key informants from 15 at the time of 17 RIC member institutions. So this work probably goes back about 4 years. Qualitative data analysis, we shared back with all of the 15 interviewees, and then we shared with the RIC network in an annual meeting to obtain feedback. So we listened first. We fed that back to the participants or the interviewees, and then we workshopped it within the network annual meeting. So we iterated the data and pulse checked the data with the network. And what did we find? We find the benefits of networked learning is really, and I'll talk about each of these, stability in rapidly changing institutional contexts. I think I saw that there were 4 women's health research institutes across the country, which is great. All of you are affiliated with with one or more of those, and you likely also might have an appointment at a university or another type of institution. And whoa, can I say that our institutional contexts are changing rapidly. You know, budgets are becoming an issue. We've got, at least in my university, where we are cutting back on internal institutional supports for research. We are cutting back on supports for conference travel. So having a network really allows us to not just share that pain, but share the solutions as well. So stability in rapidly changing institutional contexts. We bridge knowledge mobilization scholarship to knowledge mobilization practice. And this is something that some authors have recognized an irony in, that knowledge mobilization practice is not, for the most part, based on knowledge mobilization scholarship. It's a bit ironic that we promote researchers working with practitioners, and yet we don't do it that very well ourselves. And so that's why Steve McGregor, as a researcher of knowledge mobilization at the University of Calgary, and I, as a practitioner of knowledge mobilization at York University, we've come together to try and bridge that scholarship to practice. What we recognize, and I've talked about this a little bit, is these institutional units or roles. We've got professional knowledge mobilizers whose job it is to take what we learn within the network, take what we learn from knowledge mobilization scholarship, and benefit our researchers. It's not that we say no to researchers coming to Research Impact Canada, but it is more about these institutional units and the institutional roles. And I reflect that all of our universities and most of our research hospitals have some form of commercialization or technology transfer units. Well, we are advocating that those functions which are ubiquitous need to also be there for the non-commercial pathways to impact, the pathways from research into policy, into social services, or into professional practice. We also recognize that networked learning gives us a space to live within the tensions. And the tensions that came up within our interviews, there was this tension between flexibility and stability. It's nice to have that stability to up in that stability in rapidly changing institutional contexts. But if you've got too much stability, you don't have enough flexibility. And as I mentioned, we've got research administrators, we've got evaluators and community practitioners and librarians and in our network. We need to be flexible. So the network provides space to live between flexibility of skills and types of jobs and stability that we all seek. Also, the tension between openness and efficiency. Everything that we do at Research Impact Canada is all the products we produce in French and English, and they're all openly accessible, which is great. But if not everything is open and we became really internally focused, we could be more efficient because it means we're just doing it for ourselves. So we try to find the space to live between openness and efficiency. And similarly, I've talked about this about different roles, diversity and unity. If we all look the same, it would be a lot easier and more efficient, but we don't look the same. We are diverse individuals, not just in our personal identities, but in our professional identities as well. So being in a network helps us navigate that tension between unity and diversity. And then finally, the tension between self and collective interest. And that if all I do is want to benefit myself, that's a fairly, I don't want to say easy, but that is one construct that is in tension with the collective interest, where it's not about me. It's not about York. It's about Research Impact Canada. And this was, when we first had our first U15 member, I won't say who they were, was looking at joining, a number of the non-U15 members going, ooh, because we're really good at sharing. And the U15 member, we were concerned about would they be coming in for the collective interest or would be coming in as a competitive nature. And you know what? They were great. They checked that competition at the door and they came in and they shared and they learned. And so this is where we are. It's about the collective interest. And then finally, relational and technical. And I'm going to show you what I mean by that on the next screen. So technical and relational, ignore research, admin, and broker and engagement. That's for us as Research Impact Canada, two broad functions that we fill. But look at the middle. Facilitating knowledge mobilization is a combination of technical things that we do. So understanding context, coordinating activities, staying abreast of best practices. That's technical. It's things that we do, but it's also balanced with relational, the things that we are. We maintain communications, we value and assure equity, we build capacity, we build trust. And so what we really found out from our research was this relational technical piece was really important in that it's not one or the other, it's a balance between these. And personally, when I reflect on this, I think technical is the things that we do, and relational is what is enabled by that technical.